Hi, my name is P.A. Clarke. I am a facial aesthetic specialist and pioneer in facial rejuvenation using the best products and the latest techniques to keep my patients happy. We will be talking about facial beauty and what is possible with non-surgical facial rejuvenation. At Diamondworks Med Spa, we deliver amazingly natural, life-changing results. We help you consider what's possible and work with anyone wanting to reverse the visual signs of aging. But best of all, our results last. Welcome back to Diamondworks Podcast. My name is Clarke, P.A. Clarke, and I am here with Russ Amanoff, or as I like to call him, Amanoff the Great, or Becoming the Great. Hey Russ, how are you doing?
Good. How are you, Clarke?
All right. Okay, so I have a few questions for you. We're going to talk a little bit today.
Mm-hmm.
Now, Russ has joined us as an intern approximately 10 weeks ago, right?
Going on 11 weeks, yes.
At first meeting, I knew you were amenable and you had a great opportunity. I think what makes you outstanding was your vulnerability, not being afraid to show me that vulnerability in not knowing, and your ability to learn and take on some of the direction necessary. So I love that about you. You weren't afraid to say, I don't know. Um, Tell me what you feel really impacted your growth with us.
I think it's the time that I put in with you.
Mhm.
You told me from the beginning that I was gonna have to come in and put in the time. I'm supposed to be here 2, 3 times a week. And when I started putting in that time, I started seeing the fruits of my labor and how my techniques were improving daily. So I'd come in the morning, I'd inject, and by the end of the day, I'd notice how much better my injections had gotten by the end of the day. So I felt much more confident in myself,
Right.
especially now after 11 weeks.
After your hands are not.
I mean, as you know, my hands went from
Yeah. Now
shaking
you're more
to a
steady.
much more steady ninja-like
Yeah,
technique.
there you go. I'm an off the great guys. So I know you've learned a lot, and if you would describe two things that you are taking away that you believe might be life changing to the way you practice medicine, not necessarily medical aesthetics, but the way you practice medicine from here. What would those two things be?
What I learned from you and I've implemented myself is customer satisfaction. If a patient is coming in for aesthetics or if a patient is sick, at the end of the day, the most important thing is the patient is satisfied when they leave your door. So the biggest thing I learned so far was not one of the biggest things is patient satisfaction or customer satisfaction.
Right.
You want your customer patient to get what they're paid for or what their insurance is paying for.
Right.
And then I mean the next thing I'd say is sort of my technique, which I learned from you as well. The technique is the most important part, no matter what you're doing. As you explained earlier, it's kind of a recipe that you just do over and over and
Oh,
over again. At the end of the day, you're repeating the same thing. The recipe tastes good. You don't change the recipe.
that's right. That's right. So I always make the analogy: you're a great chef. Everyone knows you for your, what do you make at home? Chicken marsala? What do you make? Okay, so
My
everyone
wife's the cook at home.
everyone knows you for that dish. You can't change it. You
It's
can't
true.
say, well, let me use this filler instead. Let me use another filler and try to get. No, you've got to do the same thing over and over and over again. But that's what makes great people great. It becomes almost boring to us because we're doing the same thing. But that boredom allows us to think about other things that no one else is thinking, where we continue to get better even though we're pretty good. So I like the fact that once you can get the technique out of the way and you don't have to think about the technique, where you don't have to think about the needle depth, the angle of the syringe, how far, how deep you go, how much you push pressure, when you don't have to think about the things that can give variability in results, now you can think about how else can it make my client look the best. What was the second thing?
Technique, the sauce, the recipe.
The rest of
The
it.
recipe's good. The sauce
Okay.
tastes great.
All right. Um, One more question within the training, then I'm gonna jump out of that. Everyone here knows that Russ has started interning with me, and I mean, it's I've seen improvements in leaps and bounds. He definitely will take over a lot of what I do, obviously in due time. He's great with the lips and so forth. But on that, what is the area of the face that you feel most challenging?
Challenging. I'd say the tear trough.
Tear trough. Yeah. So in the previous episode with Melissa, you'll all hear Melissa if you listen to the episode prior, is that we discussed tear trough and how tear trough is one of the most difficult areas in the face to do. And the tear trough is that depression under the eyes. It's that semicircle under the eyes. Some people at 15 years old, they have this depression. Others, it starts in their 20s or 30s. In any event, it's a tear trough, and it's the medial or the lateral tear trough. The medial tear trough is closer to the nose as it goes out. The lateral tear trough is closer to the edge of the side of the eyes as it wraps around the outer cheeks. This tear trough has boundaries. Those boundaries are the fat pad, the superficial malar fat pad, the nasolabial fat pad. There are other structures that are incorporated into the tear trough that allows it to be a more difficult area to treat. Russ, once you know the fundamentals of the anatomy of the eye, the cheeks, the tear trough, that combination, then tear troughs become much easier to do. So I wouldn't worry about it. You'll be there in really, really no time. I believe it's important for patients to bring pictures. What do you think based upon that statement? Do you like when our clients bring pictures on their phones to you? And what don't you like about it?
So we had an experience last week where a patient brought us a picture on her phone of what she wanted to look like and what her expectations were. And in the picture, she was obviously sunburned, and it kind of made the wrinkles look less visible to us. And she explained to us that's what she wanted to look like. And unfortunately for her, we weren't able to do that because it was kind of a catch-22 where she
But
would.
didn't she have? But weren't her results near to perfect?
The results were awesome. They were great. They were exactly where they were supposed to be. But
Did she say that the results were also really good?
yes, she did.
I remember her saying that they were better than her other practitioners. However, she wanted her skin to be more glowy or thicker or whatever the case is. But
Yes.
so here's my point. You need pictures. You need to understand where the patients are coming from and what they're saying. Um, uh, so many times clients or patients have something in their mind that is easily reproducible, and other times it's not reproducible. But you'll never know that unless you see a picture. So I encourage my patients to bring pictures. Listen, you've got to bring a picture. There are many practitioners that don't like to see pictures because they think it's a waste of their time. If any practitioner thinks that you're a waste of their time, you need to leave that practitioner's office. You're not a waste of the time. This is a craft that has to be learned. Bring your pictures in, show us what you want, because a picture speaks 1,000 words. You can tell me something for 10 minutes and show me a picture that's totally different than what you're telling me. So bring the pictures if you have pictures that you want.
You think it's fair to bring a picture though that was taken 10 years ago, and they're like, "This is what I want to look like now."
So
It's a little
here,
unrealistic. And
oh, mhm.
at least what happened with her, she came in with a picture that obviously looked 10 years older than she was now, and she wanted it to be reproduced.
Right, right. It's yes. Regardless of if the picture was 20 years ago, you want to step in the mind of the patient. So if the patient brings a picture from when they were 25, but now the patient is 50, that's okay. You want to step in their mind. Look at how full the cheeks were. Look at how where the nose was. Look at what the cheeks were doing, what the lips were doing. How wide was the jawline? Was the jaw angle sharp? Was the chin protruding? Was the chin strong? Where were the eyebrows? So then you get a chance to see what that patient is seeing every night she closes her eyes. Now you get a chance to reproduce as close as you possibly can to what that patient really thinks is beautiful, because we all think we're beautiful. And especially when we're 25, we think that we are the most beautiful thing on this earth. And therefore, when we hit 50, we want to at least have some resemblance of that. If you see the patient's picture from 25 years ago, you have a better idea of what that patient is trying to tell you that they want. Now, the 25-year-old that brings a picture, they're not going to bring a picture from when they were 6 years old. They're going to bring a picture from maybe of someone else, of a model or a singer, someone that they like on Instagram, an influencer, and this is where the picture is coming to be very valuable in that consultation and that treatment. Always see the pictures. It may take a few more minutes within the room, but those minutes translates into a happier client. Um, so tell me about your favorite patient experience at Dynamo.
My favorite patient experience.
Because you've got all of the young girls. Russ has all of the young, beautiful girls coming into the office, and they look amazing. Um, I'm married, so it's cool for me to say that. They look amazing, and I want to keep them as beautiful as they can. And I'm so happy that they're starting very young. But this guy is bringing all of those beautiful women into the office on the younger side. I bring the beautiful over 30, gorgeous. He brings the beautiful under 30. Um, what's your favorite experience?
I mean, when they are younger, they're already pretty or beautiful, and they have that vibrant skin. So they're coming in to look better than they already are. So I feel like that's a challenge in its own sense because they come in pretty, they're looking for a result. So you're supposed to take them from 8 to a 10 or a 9 to a 10 or a 10 to a 12.
Yeah.
But I feel like my most memorable events were those experiences where they came in looking really good already and me bringing them up and making them look even better. And I know that they're happy with the results because they tell me. And then they also follow up with me on Instagram. They shout us out. They post pictures of themselves. So I feel like those events where they're good looking already and they look even better and they're happy with the results, those are the memorable events so far for me.
So, do you know the biggest difference between treating the, let me just say, under 28 versus over 28? The over 28 starts to see this as a necessity. They need to have this done because this is falling or changing or moving left, right, south. Younger than 28, and that's just a rough number, younger than 28 treats this as an accessory. Accessorizing the cheeks, accessorizing the nose, accessorizing the lips, accessorizing the chin, and so forth. There's a blend. There's a blend because you can also see this as a necessity, but also accessorizing. So what you're saying is that younger clientele that wants what they want, period, regardless of what they look like. And some of the older clientele, they've been there, they've done that. They kind of just want things a little easier, a little smoother. They want to wake up, look great, don't have to do too much makeup out the door. That's what I think I provide for them. The younger generation that sees it as an accessory that they can add, I absolutely love that because that's not what we had in the early 2000s. Early 2000s was just treat, 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 treat. I hate to call these treatments. I really do. I think of them more as you're doing something to improve upon what you either already like, in the case of a lot of your clientele, or what you had prior or want to have. So that's the way I see it. So yes, we did a ton of lips last week. Was there anything challenging on lips that you noticed where many providers kind of fall prey and kind of screw or botch others' lips?
Yeah, for sure. I mean, we have a very interesting technique compared to everybody else. I'm not going to disclose too much about it, but it's different from what everybody else is using because I've seen videos of my friends get lips and they get 30 injections into their lips and they leave the um, they leave the doctor's office or the PA's office with these full lips, and then 3 days later they don't have lips anymore. And the reason their lips are so swollen and they look good is because they were injected 50 times while they were in the chair.
Right. So what you're talking about is technique.
Technique, yes.
Technique goes a long way. Technique, technique, technique. Doesn't matter what you do. You could be a dentist, a surgeon, medical aesthetic provider like we are, a plumber, electrician, stylist. Technique is so much. Technique is going to allow you to have the results you're asking me for. If my technique is off, I cannot reproduce the same results, even if I use the same product that was used before. So technique needs to be maintained. One of the things in terms of technique and lips is um, there's something called Russian lips, right?
Yes.
Russian lips are those really full, angulated, defined lips, and it's all great and so forth. But one of the problems is that some of the techniques to create these Russian lips are ill advised, and we start to destroy that vermilion border by poking holes through the vermilion border with a needle several times. And then they're using the 27 gauge needle, which is a large needle for the vermilion border. If that's done too often, what happens? Your body will develop scar tissue, and at some point, you will start to obliterate or damage the sharp border or the vermilion border that you have. So the technique that we typically do to create Russian lips is that we don't go from the surface or from the vermilion border, but we use other measures to create even a better Russian lip, as opposed to creating the trauma and the blood and everything else that you will see.
Yeah, I've noticed that. Like a lot of the patients that I see or people that I see outside when I go out is they basically have a blended lip where they don't have a vermilion border
They
anymore,
lost the vermilion
and it
border.
goes just from lip to skin,
Yes,
and it
yes,
kind of starts looking weird after a while. And now I understand why. It's because the
right,
vermilion border was injected a
right,
hundred times.
right, right. So there's one thing, technique. And then what goes with technique? The product being used. So I have my favorite products, everyone does, but my favorite products were born out of the necessity to to create a wonderful result over and over and over again. Understanding the type of product being used helps you to recreate certain images in the patient's face. So I love products that do not move as much, right? So fillers, right? We know fillers once injected, they can either spread or they can stay where they are. I like the products that stay where they are. The products that tend to spread too much is the products that create the issues on the upper lip and so forth. Have you seen anything outside? Say outside of this medical practice, have you seen anything on the outside where you look at the patient, at the person's face, man or woman, and wondered why they chose to have that done, or something that was strange or weird or just not right in the person's face?
Well, it's all about education and whatever being advertised to you. So people are always telling me, "Well, I got Juvederm and I want Juvederm," and I ask them, "Well, why do you want Juvederm?" And they never really have an answer. This is what their practitioner is using. They don't know what Juvederm does. All they know is that's what they're using, and they can't really tell you why they're
Right.
using it.
Well, I'll tell you why, because it's advertised that way. Now, Juvederm is not a bad product. I think it's a wonderful product. They're all wonderful products. But these are just tools. If you come to fix my roof, just bought a house. If you come to fix my roof or to repair my roof, and you're come to me using a shoemaker's hammer, you can't do a great job. If you come to fix my roof and you're using a ball peen hammer that's used in metalwork, metalcraft, very heavy anvil like hammer, you're gonna damage my roof. But if you use a roofing hammer, then I believe you're gonna have a better result. So it's all about what we're using. So what happens is within the pharmaceutical company is that pharmaceutical companies, many of them tend to market to the patient only. Go to your doctor and ask them for XYZ. You know, then the patient may say, well, I want this because I'm going to get that picture that I saw that woman in that commercial. This is not the case. This is false, because what it does, it forces the practitioner to use a product that they know may not be the best product for the patient, but because the patient wants a particular product, then bad results can be attained. When you go to your practitioner, what you don't want to do is to choose a product without understanding what that product does. Otherwise, you're going to have issues. You need to make sure you know what product is being used. You need to make sure that you see the box that's being opened in front of you. You need to make sure that that is not a counterfeit product or some product shipped in from some other country being used by some person in some hotel or some back office that shouldn't be doing that. Now, let's get back to some of Russ's experience because I can go on and on all day on this. Just know your product and make sure that your injector is using multiple products by multiple companies and not just one product for everyone. A little back about your experiences, Russ. We were talking about the art of the consultation.
Mm-hmm.
So I am very passionate about this, and that's why my tone goes up and I start speaking faster. I really want the public to understand that medical aesthetics is not about superheroes or it's not about a product that magically does everything. It's really about the creator, the craftsman, the sculptor who's using that needle on your face. With your experience and what you've seen in the office, um, how would you say, have you seen any other injectables or injections before you came to us?
Um, I've have like amongst my friends, I've taken a course, but as far as really seeing a whole treatment plan and patients that are consistently coming back, I haven't seen the volume that we see here.
You haven't seen the volume. Now, in the course that you took, don't give me the name of the course and so forth. What did you learn in that course? I'm sure it was one of the well-known courses. Was it a well-known course?
It was. I hate to say it was a total waste of money.
Okay, so but what did you get out of it?
Like a
It,
little.
it was a Botox course,
It
a
was
filler
it was
course.
a Botox filler course. They taught us little anatomy. It was a 4 hour. I don't even think it was 4 hours. Maybe it was a 3 hour course. They taught us anatomy. They taught us injection points where the Botox or Dysport needs to be injected, which doesn't even apply after what we learned or what you taught me. And they also taught us about fillers, but they only taught us about fillers in the lips. They didn't tell us about all the other places that fillers can be placed properly, of course.
Properly, right? Properly is the right word. Now, some of them do pretty good work, but what happens is you can't get everything from a 1 day or weekend course.
Absolutely.
One of the issues that occur is that you know you get one person on stage injecting and 5, 6, or 10 people around the table watching. You can't learn from that. This is the same as watching YouTube videos on injections and think that's what you're going to get when you come to us. You're not going to get that. You're going to get something that's top of the line in an elite stratosphere. Your experience will be much better than anyone else you're going to come across. And based upon the training you had, you've been with me for 10 weeks and you've understood, or I should be asking, do you understand the level of craftsmanship that's necessary to create good results that you can't just get when someone talks at you via an on stage um, event?
I mean, yeah, absolutely. It's like somebody can tell you all day or teach you all day about how to ride a bike, but you're not going to know what it's like to ride a bike unless you get on a bike.
Right.
So this
Right.
was basically like a boot camp residency for the last 3 months on injections, and not only injections, but as you said, the art of the consultation, looking for the subtle differences people are looking for, assessing the anatomy of the face, figuring out what the patient truly needs, and what injection or what product is actually gonna get them to that optimal result that they're looking for.
Okay. Awesome.
All right, Clark. So it's been 11 weeks with you.
11 weeks.
You've been asking all the questions. Now it's my turn.
All right.
So, what do you think about where I've been and where I've come to, and how I've changed throughout our residency slash internship the last 11 weeks?
Well, I'll tell you one thing is the confidence. Initially, it was you were very timid, very shy, but that was good because you really wanted to learn. But you were very timid, very shy. You were even trying to figure out how to hold a syringe. And at some point, I swear to God, I
Whoa.
saw Russ going like this into a, and I'm like, what is he doing? So all of that is God. You're not gonna have that. He's not gonna come to you like,
Clark,
like
you're
this.
scaring my audience.
But it's
away.
it's it's the confidence. You really, really, truly understood that the syringe is a tool, and how you hold this tool, how you use this tool, will determine the results in the patient also. Or this tool can give you a lot of bleeding and swelling. And if you don't operate this tool well, you're definitely going to have a lot of bleeding, bruising, redness, and swelling. This is a beauty tool. It's not just a syringe, and it should be designed a little different. If any designers out there on this, talk to me. But this should be designed in a way that it creates less trauma for the patient. So this is your money maker. This is your tool. Confidence is what I saw that you got a lot better in. I think you're going to be a wonderful injector. Whether you stay with me or not, I think you'll stay. You can be a wonderful injector. You're willing to learn. You pick this stuff up really, really fast. You understand why medical aesthetics needs internships and residencies.
Absolutely.
And you do see that the responsibility of the provider is to make sure that they're doing everything that's best for the patient first.
I mean, that's true. I mean, I can't imagine myself going into an office and injecting after a weekend course. And even after this 3-month internship, I feel like I'm confident in my injections, but there's always more to learn, and you always got to polish your skills up.
That's it for us, guys. This is Damaworks podcast. You can catch a lot more information, insightful stuff from us. Some rhetoric that's happy, some rhetoric that maybe not so happy, but we will always give you the truth. We will give you responsible content within our podcast. Please subscribe to us. Let us know your comments. Let us know what you want us to talk about. Let us know any questions you may have. You can always reach us. This is Aminoff the Great. He's not great yet, but he will be. But this is Aminoff the Great. I am P.A. Clarke, and you're signing off.